Welcome to Deans Discuss, a podcast that examines how science and research at UC Davis affect our everyday lives. Join our hosts, Allison Brashear, Dean of the UC Davis School of Medicine, and Michael Lairmore, Dean of the UC Davis School of Veterinary Medicine, as they give their thoughts on how the work of scientists, physicians, and researchers affects us all.
Hi, Allison. How you doing?
It's great, Michael. It's great to see you.
Listen, I thought today maybe we could extend our conversation and talk a little bit about one of the things that's near and dear to us, which is training the next generation of leaders in veterinary and human medicine. So let me ask you a quick question. What are some of the most important aspects for you in terms of training the next generation of physician leaders? And of course, how has the pandemic changed that perspective?
We know at the School of Medicine, we're all about training the next generation of both physician scientists, primary care physicians, and really making sure that the workforce that is needed to take care of all the citizens of California is met. We developed a variety of programs here in the School of Medicine. There's the ACE-PC, which is a three-year MD program, and it connects students to the underserved. We have TEACH, which is Transforming Education and Community for medical students, geared to students who want to work in underserved areas. We have a particular track that's geared towards research called ARC. And we have Compadre, which is a very important collaborative program with California, Oregon, medical partnerships to address disparities in rural education. And so that's designed to connect students from underserved backgrounds, tribal backgrounds, urban communities to medical school and residency. In medicine, we can really make a difference if we train a diverse group of providers. And one of the things I'm really proud of is the fact that our medical school is getting more and more diverse. And that's something that takes intention to do that.
Mm-hmm. For sure. That's very much so. It's interesting how many parallels there are between medicine and veterinary medicine, and in terms of that philosophy or that broad theme that runs through our educational programming and training. That community-based effort and looking like the demographics of your community, critical for our ability to serve our communities. And we're also recruiting in those same diverse workforce areas. Because if we don't have that, we're not able to serve the communities that we want to. So that's near and dear. And so we also, like the School of Medicine, look for collaborations to do that as well. Of course, here on campus, we often have great collaborations, but we also have had a really good luck with a regional consortium. This is a consortium of the schools and colleges in the Western region. And we started this probably about 8 years ago as a group of deans, and then developed regional teaching academies. And these RTAs, as we call them, have been instrumental in new and initiatives that teach new ways of pedagogy. They have conferences. And these were really starting to exchange. We've even had now scholarship publications from that collaboration on best practices, peer mentoring as well among teachers. So that collaborative spirit really helps extend that ability to really make our mission impactful and sharing those resources. The difference, I think, is we are a smaller community. We only have 30 colleges and schools in the United States that are accredited. And so we need to collaborate in part because we can't do it all. We're very comprehensive here at UC Davis, but with that collaboration is really important to really make us stronger. So, in terms of you've been here for 18 months, believe it or not. That's time flies. It seems like you were just a new dean to our campus not very long ago. But in those past 18 months, when you reflect upon that, what are some of the things that you think that you've learned in the last 18 months or so, just as a leader in these programs?
Well, first of all, Michael, I have to thank you for bringing me to UC Davis. You chaired the search, and it's been just a wonderful partnership with the School of Medicine, School of Veterinary Medicine. You know, COVID has shed a bright light on health equity issues, and I think, you know, to solve these very complex problems, we're going to need teams, and we're going to need diverse teams, and we're going to need new thinking. And so I think that's the one thing that has just become so important to solve any of these problems, whether it's developing new drugs, new technologies, getting treatments to the patient. We need really lots of different types of thought, and nothing's more complex than solving this problem of health equity. You know, now we're trying to get vaccines out to patients. We're trying to get treatments out to patients. But, you know, a School of Medicine and the whole academic community is really just poised to solve complex problems. And that's why the partnership with the School of Veterinary Medicine, Ag, all that UC Davis has and all that UC has is so important, because it takes lots of different types of thinking to solve complex issues. Not one person's going to be able to solve these things.
That's for sure. You know, one of the things that's been inspiring is the response of people to the pandemic and how they've had to make adjustments, like our, you know, our faculty that have been parents at home taking care of kids, you know, and their ability to have both a juggling act of their own families, but also how they accomplish their mission in their academic jobs, but also our students. Every year at the ceremony where we have an induction ceremony, I always like to look for the highlights of inspiring stories. And one of our students, right as she learned she got into veterinary school last year, also learned that her mom was going to be a recipient, needed a kidney transplant. And so she turned out to be, of course, the best donor, and donated her kidney to her mother just about the time she was accepting to come into professional school. And she's done quite well, and her mother, they've both recovered, and she's doing well in school. You know, those kind of stories, you know, as deans, you know, it inspires us because we know that they come from a variety of backgrounds, experiences, and they add to the depth and breadth of our experiences here within the educational programming. And they become, I think, better physicians, better veterinarians when they have that kind of compassion for each other, as well as their communities that they come from. And so we try to support that. You know, I mean, you know, like you, we develop a lot of support structures, career centers, wellness centers, mental health and wellness counseling, which we've talked about before, so important, and also other activities that allow them to know each other, the student clubs, the extension into the community that they serve. We'll talk about that as well. But, you know, those are all supportive networks that really tie us together as people, even though we work on different patients. You know, our commonality and compassion for the mission is in common. So, like you, I'm sure you are inspired by those students that you learn to know as individuals and as families. And you know, it's easy to get distracted with our current problems, but we have to think back at what we were like as students. You know, what inspired us to become, in your case, a world-renowned neurology researcher and leader in academic medicine. You know, but when we think back to put ourselves in the position as students, you know, that's the kind of inspiring story that, you know, leads to future leaders as well. And I know that's both of our jobs.
Yeah, well, and Michael, you've had such a tremendous impact on being dean. What's one of your most inspiring and heartening moments during the long course of your tenure?
You know, it's hard to put any one into context. I think the most one that was most emotional is we actually had a student that was murdered in her last year, about 3 months before commencement. And it is a shock that ripples through the entire system. All of us the families that was involved, the whole campus, really. What we had a ceremony at commencement where her animal dog and her parents walked across to get the diploma. And that was a moment in Mondavi when everybody was silent and we were all thinking about the tragic loss of that individual. But what inspired people from that is to honor her. And so now we have a scholarship named in her name, and she lives on at each one of our scholarship banquets each year. And we honor that through remembering what she stood for, and then the outpouring of the community. And I think that that's when we talk about education, when we talk about training, when we talk about, our impact, it's really about people. It's about, saving lives. It's about, saving their animals that love them. But it's also about us connecting. And we need that in this world today. We need that compassion because tragic events happen every day. And we need to be inspired by them and then to learn from them. And so, yeah, there's been a lot. And what about you so far, Allison? And you've come to us with a wealth of experience. And, I know childhood diseases play a particular role that inspire you, but what are some of the inspirational stories since you've been here?
I think the inspiration was to see how everybody just worked together in the early part of the pandemic. I mean, I still remember walking into the command center and talking about how we were bringing research trials directly to the patient. And no one asked what their role was. Everybody just jumped in. And I know everybody there did. And it was really inspiring to see how committed everybody was in a heartbeat to do anything that we could. And that has continued. The amount of teamwork across our campus, our schools, has been just unprecedented. And it is really, I think, bonded everyone together, that we're about improving health. Right? We're really not about a single disease because we're about improving health. And we do that in a variety of ways. We teach the next generation, we find the new cure, we bring the trial, we do everything, but every single person who works here is about improving health. And I think that's just been so just laser focused come into light for me. Michael, you've had such a tremendous impact on everyone, and we've just been so appreciative. I've loved doing these podcasts, and we've got one more here to do, but it's just been great. The partnership has been just terrific, and it's just what the heart and soul of UC Davis is all about, is this collaboration and teamwork.
I think when we think about what brings us to work each day, it's that excitement of what can we do together. And you've illustrated that since you've been here. I think I'm looking forward to the future. Even though I'm stepping down as dean, I'm looking forward to the next administration. I know our campus is actively recruiting for the next leader, and I'm sure they'll enter into this. But I think laying the groundwork for that next group of leaders to come in and take what we've developed and continue and build it even better and brighter. And so I look forward to our next podcast, in which we think about how we impact the communities around us much. And you've illustrated that many times in the last 18 months. And I'm looking forward to that discussion as well.
All right. Take care. I'll see you in a bit, Michael.
Okay. Take care, Allison.
Like what you heard or have an idea for a future episode? Email the deans with your suggestions at deansdiscuss@ucdavis.edu. And don't forget to subscribe so you don't miss an episode. Deans Discuss Podcast is available free on demand at Apple Podcasts, Google Podcasts, Amazon's TuneIn, Stitcher, Pandora, and Spotify. This is Deans Discuss.